Hi guys, it's Shelly from Adventures of a Labor Nurse. I just got out of an absolutely amazing presentation by Dr. Suzanne Baird and Dr. Betsy Kennedy that talked about supporting families and care providers after a maternal death. This is the first time that I know of that a presentation has been offered that addresses how care providers specifically cope with maternal mortality. Hey guys, I'm going to try really hard not to cry because that presentation was teary. I've never really seen anyone give us permission to kind of talk about maternal mortality and the effects of maternal mortality on our emotional health as healthcare providers. When there is any type of adverse outcome, I think that patients, they don't stop coming in, they don't stop needing us. So it's kind of our job to just continue to take care of everyone else. There's no forum for providers to talk about traumatic experiences, and it's not really allowed, and we still have a job to do, right? So as many of you know, my mother has been a NICU nurse for 40 years, and recently a friend she reached out to me and she told me that her cousin had decided to go into nursing school, and she thought she was going to get the chance to follow my mom in the NICU. And her cousin was, hey guys, her cousin was so excited to get an opportunity to follow my mom because it was my mother who had taken care of her when she was born prematurely, and it was my mother who had helped her while she was in the NICU. Her mother had died during childbirth, and the family still remembered the care that my mother provided after this tragic event. So when I told my mom this, she immediately, without hesitation, told me her name and the room number that her mom had been in. I'm sorry. So, as all of you guys know, I'm at the A1 convention in New Orleans, and I think that this convention has been so great and so informative, and I'm so appreciative that A1 offered a presentation like this one that validated our need for emotional support after a maternal death or any adverse outcome. I've known of Let me think of how I'm going to say this. I've known of a maternal death every single year that I've been a nurse. And even after all of these years, thinking about even my mom taking care of, that one particular patient all of those years ago, maternal mortality is still an issue. It's still a problem, and it's a growing one. And so I just wanted to say thank you. Hey, Keisha. So I just wanted to say thank you to every single person out there that advocates for the health of women and babies. Everyone. So thank you to every single person who's a member of their professional organization like A1 that fight on our behalves for the population that we love so much and that we work so hard for. And if you're a patient that's ever experienced an unexpected outcome, I want you to know that she remembered your name and your room number, and we all remember and we know. And I want everybody to just continue to fight for change, because it has to be better than this for women and babies. And so thank you to every provider out there that fights for women and babies and that is a member of their professional organization, and are supporting those people that are fighting for us.